Hello, I'm Dr. Stephen Stokes and welcome to the channel. Today I'd like to talk a little bit about the lower esophageal sphincter. I had a question about how to treat the sphincter, and I have a lot of experience with this. I've been treating the LES for more than 20 years. You hear a lot of things, especially online, about how certain foods cause the lower esophageal sphincter to weaken, things like alcohol and chocolate, and that it's really a problem with food. It's a dietary problem. But that has not been my experience. And what I'd like to go over in this video is what I believe the cause of a weakened LES is. And of course, I'd like to share with you how you can treat it, how you can strengthen that sphincter, which is going to resolve a whole bunch of really complex symptoms that you may be experiencing, like heartburn, for example. So first, let me explain where the lower esophageal sphincter is. A lot of people think it's sort of here in the lower throat, but it's actually much lower than that. And so where this sphincter is located is about 20 centimeters. So this is 20 centimeters, about 20 centimeters below the bottom of the cartilage in your throat. So right here, so you can see right at the end of this tape. So this is where it's located. It's in the lower part of the breastbone, right where the ribs come together. It's also where the diaphragm is. And the LES is about 3 centimeters in length, which is about the size of this actually here. So this is pretty accurate. And it's a circular, smooth muscle that runs around the bottom of the esophagus, right where the esophagus joins the stomach. And its normal state is that of tone. So it's normally restricted and snug and tight, and it prevents contents of the stomach from going up into the esophagus, which is a good thing, right? Because the stomach is mainly acidic, and we don't want all that nasty acid in our throat. But when it happens, we get, for example, heartburn and other complications. So why does this happen? Because it is the natural state that sphincter stays tight. What would cause it to weaken? Now, like I mentioned, you're going to hear that certain foods can weaken it, and they may have some involvement, but really the esophageal sphincter, the lower sphincter, it's controlled mainly by the vagus nerve, right? That has a big part in controlling the tone of that sphincter. And so what I see clinically is I see a weakened LES as a neurological pathology, a neurological compromise, right? The LES is controlled, like I mentioned, by this vagus nerve, and it's part of the autonomic nervous system. So the autonomic nervous system is the part of your nervous system that you don't really control. It's the part of the nervous system that regulates things like breathing, your heartbeat, digestion, right? The things that happen in your body that you have no real control over, that's the autonomic nervous system. And the tone of that lower sphincter is controlled by that autonomic nervous system. So if for some reason that's weakening, then it's usually because there is a problem with the communication between the nerve, right, and the smooth muscle. And it is a smooth muscle, so it's not a muscle that you can build and develop like your bicep muscle. It's a muscle that is in place and is supposed to work as long as the nerve signal to that smooth muscle is operating correctly. And this is where I believe the dysfunction is. I got to tell you that I have 100% healed patients with a weakened lower esophageal sphincter. And these are patients that have been on medications, that have tried everything. I've completely healed them in a couple of weeks by putting them, for example, on valerian complex. So what's the connection, right? Why would valerian complex help with that? In fact, when you think of valerian complex, you think of something that relaxes the body. So you would think you're going to relax the sphincter, but you're not. Here's the ideology. You use valerian complex and it relaxes and balances the autonomic nervous system. So what that means is that as it relaxes the fight-flight response in your body, it allows your nervous system to balance and to normalize. So the normal state of the nervous system, that relaxed state where the autonomics are balanced and the sphincter can then, can tighten as it's supposed to tighten, That's one of the benefits of relaxing the nervous system with a product like Valerian Complex. And again, I've completely changed the tone of the lower esophageal sphincter without any dietary restrictions at all. Now, having said that, right? If you're smoking, why are you smoking? You're crazy, right? Smoking is going to kill you. If you're drinking alcohol in any amount, why are you doing that? Especially if you're sick, you know that that's going to compromise the systems of your body and you shouldn't drink. Likewise, if you're eating too much chocolate or drinking too much coffee, if you're finding that these things are having an effect on your digestion, stop doing them, right? Or at least temporarily stop doing them so you can get your body to heal. Now, there are a few things that really help with this process. As I mentioned, the stomach is supposed to be acidic, and the acid content, the acid level of the stomach is actually one of the things that keeps the LES tight, if you can believe that. So you want to have lots of healthy acid in the stomach, right? And if you do, and that pH of the stomach is really low, it sends the signal to the nervous system to keep the sphincter tight. And so we find a lot of patients have abnormal stomach acids, and we like to give them a digestive product, a product that helps with their digestion and increases the acid of the stomach. And I like Zypan. I've used Zypan for almost 20 years, and it works really good because Zypan has in it HCl. It's got the acid, which is going to help with the breakdown of proteins, and it's going to signal the LES to be tight, but it's also contains pancreatic enzymes. It also contains pepsin. And pepsin is the real key. It's not the acid, it's really the pepsin. Pepsin is the key to break down protein. Pepsin is also the product that if that pepsin gets up through the sphincter into your throat, it can just sit on the tissues of your throat, not cause any problems. It remains basically passive until you eat, for example, certain foods like proteins, and that can activate the pepsin to break down those proteins as you bring them through the esophagus. And then the pepsin can actually start to break down the tissues of the esophagus. So we don't want that, right? We want to keep everything in the stomach. And I recommend patients take Zypan. You need to take quite a bit of it. It could be between 3 to 6 of those pills. Take it just before you eat. And the idea is that's going to really acidify the stomach. And some people will only need 3, like I said, but I've had patients have to take up to 6. How do you know how many to take? You start off really small, take a couple, see how you feel. You don't want to get a burning sensation in your stomach. If you start to get a burning sensation, you're taking too many. If you're taking them and you get a little tingle there, that's probably about where you need to be, right? And then you can always increase that as you need to increase it if you're eating a more protein-based meal. But again, most patients, around 3 of those before they eat is an ideal supplement to take, that over time it will train the esophageal sphincter to remain shut by increasing the acidity of the stomach and sending that signal to the brain, basically. Now, there are some excellent healing modalities that I have found that can actually stimulate the LES to tighten. And how it does that is by stimulating the nerves, right? It's all about making the nerves healthy. By far, the very best therapeutic device for this is this. It's called a flex beam. I've made many videos on this, including a masterclass that you can watch. The flex beam is a red light therapy device, and it has 3 different settings. I love this device for a lot of reasons that I won't go into right here at this video, but you can see that you can mold this around your arm or around your knee or different places that you need to treat. And one of the problems with red light therapy, right, is that you have to have the emitter directly on the skin. The more space between the light and the area that you want to treat, the target tissue, the more loss of photons and the less effective. So that's why these big red light panels, not really good in my opinion, but this you can get it directly on the area. So where do we want to put it and how do we do it? Very simple. Well, I'll turn this one on. This is mine. I own 2 of these. I own a charcoal one and a white one. So I want to use the first setting, setting number 1, and here's what it looks like. You can see it. And setting number 1 is going to give you the strongest amount of photons, but it won't project very deep into the body. But we don't need it to go deep into the body, and I'll explain why in just a minute. So remember, I said that the lower esophageal sphincter is right around here. So we take this, and we're just going to lay it like this across that area. This is a great way to do it. You're covering the whole area, right, like this, and you're going to use it for the treatment time, which I think is around 12 minutes. This is going to super saturate all of the receptors in the skin above the LES. And they're going to get just bombarded with red light, which has been shown to be very therapeutic. It activates adenosine triphosphatase, ATP, in the mitochondria, and it gives you a lot of energy for your body to heal and do what it needs to do. In this case, for the LES sphincter to tighten and work properly, right? So this is on that area. Those skin receptors are going to pick up the photons of light, and they're going to stimulate the nerves in those receptors, and those nerves go deep into the body, and they connect with the LES and with other target tissues. And that's the key, right? It's an indirect way to activate the nerves that also control the LES, the same nerves that control these little dermatome patches and little myotome patches and stuff on the surface of the skin. Those nerves then have a secondary function where they also innervate some of those internal structures. So we do it on setting number 1. Then after we complete that, I also like to switch over to a setting number 3. And here's what number 3 looks like. And you can see that it's not quite as, doesn't seem to be quite as bright, right? And the reason for that is that a setting 3 combines red light therapy with infrared therapy. And so we take this in the same place, and now what we're doing is we're still getting some red light on the surface, but that red light is not going to penetrate as deeply. But the infrared therapy is going to go very deep, right to the tissue, right to the LES itself. And it's going to basically give that LES a workout. It's like giving it a sauna, if you will, right? It's going to really, in a controlled manner, stress the LES. It's going to strengthen those neurological connections to this tissue. It's going to make it healthier. So I'll run that complete cycle. You can see how that looks for the allotted time as well. And then finally, what I'll do is I'll go back to a number 1 setting. By the way, number 1 setting is my favorite setting. And I'll go to number 1 setting, right? The the massive red light setting, but it's only cutaneous, it's only superficial. But I'll take this and I will place this here, right? Just under my chin, on my neck, like this. And you can see I'm just saturating the neck. Now, you're going to ask yourself, I'm going to turn this off. You're going to ask yourself, I may use that later tonight. You're going to ask yourself, why am I treating the neck if I'm trying to activate the nerves to the LES? Well, we talked about the vagus nerve. And the vagus nerve, it's a cranial nerve, right? So it runs very deep in the body. It's not easy to get to. You can't just sort of, grab hold of the vagus nerve because it runs deep. It's a cranial nerve, right? It comes from the cranium, the brain, basically. And so what we do is we find other nerves that have pathways that connect to the vagus nerve. And by stimulating those nerves, we indirectly can reach the vagus nerve. And my favorite choice for that is the superior laryngeal nerve. And that is, just so you know, that is like right here, okay? Right here. There we go. Right here on the top, right here by the hyoid bone. And this is the superior laryngeal nerve. And that nerve has pathways that interconnect with the vagus nerve. So we can treat that nerve and still have an effect on the vagus nerve. Also, there is another area right here, basically between the carotid artery and the jugular, and the internal jugular vein. There's an area where we can also treat that'll get to that vagus nerve. But you don't have to worry about all this, right? You just take your flex beam, you pop it on the number 1 setting, and you put that over the neck like this. You get all of that area. You're going to take care of it. You're not going to have to think about it. You're going to do that. So those are 3 treatments with the flex beam that are going to help the LES. It's remarkable, right, to think that these tools can be used to access these deep structures in the body to make us healthy. You have to remember, you're supposed to be healthy. If you have a problem with your LES, then you have a problem with the way the body is functioning, and it's usually malfunctioning because it's busy doing something else, right? Or there's a challenge there that's preventing it. Your body is smart. And if it's not doing something it's supposed to do, there's usually a reason for that. And what I find in treating patients is you're always better to just make the whole body healthier. And as a result of that, the symptoms clear up and the disease mechanisms resolve. That's the key. That's true holism, right? Create more health in the body. It doesn't matter where you start. And then all of the conditions slowly start to resolve. And that's what we're trying to do with the LES. Now, let's say you can't afford a flex beam, although they're not that expensive, really. And right now, there's a sale on. And if you use my coupon code, my name, Dr. Stokes, and there's a link provided in the description and on my website. If you use that link, you get like a $70 discount on this, a $60 to $70 depending on the time of the year, which is remarkable. It's a great product. And like I say, I think everybody should own one of these because in addition to treating the LES, you can use this for all sorts of wonderful things to make your body healthier. And I go into that in another video that you can watch. But let's say just the same, for some reason, you don't have access to the flex beam. What can you do? Well, you know what I'm going to say if you follow this channel. This is my magnet, my ceramic block magnet, right? And I have talked a lot about these in other videos. This is my Pro magnet, and you can buy these. They're very inexpensive. They're under $40. This has a north and a south pole. Well, you can take the magnet and you can place this magnet directly over the LES. Now, you could place it on the neck, right, like we talked about, but that's more complicated with this. But just place it right over the area where the LES is located. And you can do a treatment, 10 minutes, 15 minutes, 20 minutes of that area. And remember that with this ceramic block magnet from Pro Magnet, the penetration of this is very deep, right? This thing runs like 2 feet into the body. And so you're going to get a lot of penetration with this. It's going to definitely get down to the LES and it's going to treat it. And so you can definitely use this. Now, in past videos, I'm always saying that if you use a magnet, the North Pole is the key, right? North Pole is the best polarity to treat the body because it reduces inflammation, it reduces pain, it slows down nerve transmission, right, that can carry those pain signals. Makes sense you use the North Pole. But in this case, yes, I'm going to say it, this is a time when the South Pole really does a good job because the South Pole excites the neurology, right? It speeds up metabolism, it speeds up neurology. And so on this magnet, instead of using the North Pole, use that South Pole, place it over there, and really give that LES the bump that it wants. Now, what you can do if you're afraid of that, people will call me, I'm scared to use the South Pole. I get it. But if you're scared to do that, look, if you use the North Pole first for a day or two, what you're going to get is a reduction in symptoms. You're going to feel better, right? It's going to make you feel less symptomatology by using the North Pole. So use the North Pole. But once you get brave, turn the magnet over, use the South polarity, and that's going to really give you more of the regeneration, the tightening of the LES, right, and the stimulation of that you really need. And let me know in the comments what you think. Let me know if you use it. Let me know how it works out for you. These are not difficult conditions to treat once you understand what's happening. It is a neurological compromise, right? The nerve signal to the LES, for some reason, it's not doing its job. And you just need to strengthen that signal. And by the way, I've also had patients that have had herniated discs in their lower neck, in that C5, C6, C7, T1, that lower part of the neck, and they've had herniated discs there. That's affected the LES sometimes, right? If you understand the way the body works, like I do, you would know that any dysfunction in the body can cause basically any symptom. It really all works together. And because it all works together, you can treat it that way as well. You can just improve the health of any part of your body, and that's going to improve any symptomatology you're having with any condition. That's what's so great about the human body. It knows what it wants to do, right? Innate, knows what it wants to do, and it just needs to be left alone to do it. Sometimes it needs a little help, but it understands what it has to do. And making your body healthy, any part of your body, if you write down 10 things that you think are unhealthy about you, you just start picking through them. You know, my feet, right? I need better shoes or something. I don't know. But you just start picking things. You start checking them off. You know, I got my feet working good. Okay, I've got my wrist pain. I'm not typing on the computer like I used to type 10 hours a day. I've limited that. My wrists have gotten better. You just start making things healthier. And guess what? the whole system becomes more healthy and you heal. I hope that you enjoy this. If you do, please leave me a comment. And a really interesting thing is I get a lot of people, sometimes I get a little pushback where they say to me, hey, here's an article, here's a research article that I want you to look at. And, I read the articles because I do enjoy that. But these articles, sometimes I get an article and it'll be based on a study with, say, 30 people. Okay, that's fine. I get it. And a lot of times these studies are funded by companies with ulterior motives, like drug companies, things like that, or food companies. But I read the articles. But what I'd like to tell you is this. I am not a scientist. I'm a clinician. I have been in practice for more than 20 years, about 22 years. I have treated at my peak when I was younger. I'm not young anymore. I'm 55. But when I was a young guy, I would treat over 100 patient visits in a single day. I actually have seen 100 patients in a day. I did that when I was in Battle Creek, Michigan. And we would do this in the clinic. Man, we would work 5-6 days a week. If you work out those numbers, that means the potential of treating and seeing over 20,000 patient visits a year. 20,000 patient visits a year. Now, I know all of those people never had a weak LES, but what I'm trying to say is I have a lot of clinical experience, right? A lot of experience seeing patients. And so these videos are designed for me to convey to you my experience with helping those people. These are tools. They may help you, they may not. You have to make your own choice. But, don't just automatically put all your eggs, so to speak, into the research basket. You also have to pay attention to what clinicians like myself are telling you based on experience. Just think of that. 20,000 patient encounters in a single year. It's a lot of stuff, man. I've seen a lot of stuff. And of course, I haven't helped all those people. I also saw the stuff that didn't work. But these videos are designed to give you some ideas to maybe broaden your horizons as to the potential of what the body can do. I hope it was useful. Please subscribe to the channel. And remember, on my website, you can get downloads of all my books, my articles, and free consultations with me. If there's anything I can do to help, just reach out. Thank you very much.